both boys and girls were expected to just make parents' life easier. That produces lack of awareness, lack of emotional expression, and resilience.
I think for me, it started with myself.
Mm.
So OCD is a part of my lived experience as a clinician.
Whenever people find out that I'm a psychiatrist, they're like, tell me what's wrong with me. Like, what's going on?
Yeah. And that's part of my recovery journey is that my feelings and my emotions are not God. God is God.
No matter where you are, what diagnosis you have, is an image of God. No matter what happens, like, I know that God has me, and I think that gives me confidence to take more risks. Hi, everybody. This is Dr. Kim from Good News Mental Health Podcast, and I have here my friend and colleague, Luke Mayeux, and he is a licensed professional counselor and a founder of Integratus Counseling PLLC, and he started this practice to create a space where teens, adults, and couples could explore OCD, anxiety, and relationship struggles with compassion, clarity, and faith. And with a background in philosophy and seminary studies, he brings a thoughtful, integrative approach to therapy, drawing from evidence-based practices like ERP, CBT, and IFS, all offered virtually for your convenience and comfort. Luke, thank you so much for being here. I'm so excited for what we're going to be talking about today.
Yeah, thank you for having me.
So tell me a little bit about you and how did you get involved with therapy and starting your private practice? Like, what's your passion?
Gosh, what a loaded question. Yeah, so for me, I spent 4 years in Catholic seminary. So I was actually, for a while, thought I would become a priest. And then I decided after the 4 years, I needed a break because I was still unsure with my discernment. And so I took a break. I lived in Louisiana at that time, where I got a job, I started working and making friends, and which was completely different from my experience in seminary because it's a little bit of a bubble. We stay in the same place, we study, we pray, and we focus on preparing for ordination, right?
Mm.
So I realized during my time off that I really loved it, and it kind of just hit me during my time off that I didn't want to go back to seminary. And I mean, there's more to it than that. Like I really, throughout my 4 years in seminary, I struggled to see myself at the altar as a priest. I struggled to see myself administering the sacraments and just parish life in general. But the one thing I did see is I wanted to hear people's confessions. So that was the one thing that I was like, I
Yeah.
want to do this. I want to, in hindsight, what I really wanted was to be a listening ear and honestly, just to be a therapist, right?
Yeah.
So that was a powerful realization for me to have when I was in Louisiana. And I decided, okay, I'm not going to go back. Moving forward, I'm going to pursue graduate studies in counseling. So the rest was history after that. And in my program, I met my wife, who's also a counselor. Um, and so I went from becoming a priest to getting married, and now I have a 2-year-old.
Yeah. That's a great story.
Yeah.
That's a really good discernment and insight to say, oh, I don't want to do anything about priestly duties except confession. I bet that moment was like really clarifying for you.
It was, and equally confusing. Because I was like, well, how do I be a priest if all I do is hear confessions? Like it's just not a thing, right? So,
What drew you to wanting to become a priest in the first place?
yeah, so I grew up in a large Catholic family. Um, and my parents are very devout and they raised us in the faith. And part of that sort of Catholic culture is just being open to a vocation, to the priesthood, religious life, or like if you're a woman, becoming a nun, a sister, stuff like that. So, I mean, early on in my early childhood, it was already like something my parents were talking about. And so that seed was planted early on. And I think in general, throughout my life, I knew I wanted to help people. I knew I wanted to do so in a very significant way. And so for me, I was like, okay, well, I guess the priesthood is how I need to do that, right?
Mm.
And so that's like the simplified version of it.
Yeah.
But later on in my discernment and seminary, I realized, I think I can help people in other ways, and it can still be very significant, and
Mm.
it can help me to grow in holiness.
Mm. So talk to me about that because you have seminary backgrounds. I'm sure you said that it was kind of in a bubble and there's good and bad about that, right? And then you majored in philosophy, which I'm very interested in because I didn't major in philosophy, but I really like the study methods of philosophy, how you argue and debate and reach a conclusion, and mental health. So I like the name Integratus, and I think it has something to do with integrating all of this. So tell me, like, what you envision merging all these insightful methodologies, right, and belief system, and how does that come into your, one-on-one interaction?
Yeah, for sure. Great question. So, to go back a little, I was actually inspired to name my practice Integratus Counseling because I was in prayer one day. I was at church praying and things were really silent and quiet. And I just heard the word pop up in my head. And that was kind of at the time when I was thinking about venturing off into private practice and sort of making a career for myself that way, but not just a career. Like I really view this as a ministry, right? Like
Mm.
our profession is just so powerful because we're really with people in the most difficult times in their life, and the potential to help them grow in their faith as well, right? So I researched what the word integritus meant. I knew it was Latin,
Mhm.
and it means to be renewed, restored, and made whole.
Mm.
So I was like, oh, this is great. My only concern was no one knew how to say it. And so
Yep, like me.
so I took a risk though. I was like, okay, this is what's going on, all the legal paperwork, right? Um so that's a little bit of a background of the word and like why I chose it. I think in general, my mission as a therapist is to help people find renewal and wholeness in their life. And that can look different for everyone, right? So
Mhm.
I know I work with a lot of OCD, so what that means is typically I'm doing ERP, ACT with them, but I've also worked with, grief, loss, anger, men's struggles, right? Which we can talk more about in a minute, but I'm not usually using ERP for those things, and so I like to fall back on IFS, some parts work, um, maybe some psychodynamic attachment sort of stuff, because I find that those things help my clients to go a bit deeper and instead of it being more of a surface level thing, right? So, and I think that we have to help our clients to go deeper in order to really find some transformation in their life.
Mm.
So, I guess you could say I'm a bit eclectic. I don't know. I kind of just like go with the flow, and whatever the client brings to me, I know like, well, this would be a good approach, or maybe trying to combine these two approaches could be good, stuff like that. I know that with OCD, it's recommended to focus on ERP, and I do that mostly, but I also like to integrate some parts work in there if there's a lot of shame, right, surrounding the OCD. And so parts work can help the client to come to terms with that shame and find some of that inner healing that I mentioned.
Yeah. And just to fill in on our listeners who do not have mental health background, right? Like what we're talking about when we talk about ERP, CBT, IFS, and parts work and attachment theories. Basically, when we are trained in, and you can correct me or add on to it, Luke, is that we study different like methods, and philosophies, not philosophies, but like an angle, if you will, in human life and interactions, how the therapist can really dig a little bit deeper to OCD symptoms, right? Like, so what he's saying is underneath OCD symptoms, there could be a lot of shame related to it, or maybe your parents were really annoyed with your OCD tendencies in your childhood. So then it will really affect how you view yourself and other people. So what he's saying is that there's a lot of different techniques that a therapist is very fluent in, and all these things will be integrated into one-on-one interaction. Luke, is that right?
Yeah, yeah, exactly.
So whenever you're choosing a therapist, a lot of times there's a confusion. It's like, I'm a trauma, so I'm dealing with trauma. So then I have to go to the EMDR therapist, or I have to go to trauma focused, CBT therapist. So what this conversation, I hope that enlightens people, is that yes, it's helpful, but it's not like everything.
Yeah, yeah, exactly. And there are a lot of amazing therapists out there who use different techniques than I do, and those techniques can be beneficial and helpful towards the clients that they work with. So it's just important to remember that therapy is not a one size fits all. It's so individualized, it's so intimate and detailed. And I think if I were to give advice to therapists out there who are like new to the field and trying to find their specialty or trying to find a theory or modality that they vibe with, I mean, honestly, I would say do the modality that brings the most life to you, right?
Mm-hmm.
Like, do the one that you connect with that feels natural, that's fun. For me, oddly enough, that's ERP. I love exposure therapy. So, and then IFS as well.
Yeah. And a lot of times I recommend that go get therapy yourself. Usually the easiest person that you can treat is one that is very similar to you.
Yeah,
Some people might disagree because it can bring up like countertransference, but I think when it comes to such an intimate work with therapy is connection. And when you are connected with yourself as a provider, I think that allows exponential amount of connection and healing when it comes to treating your clients.
I agree for sure. Yeah, it definitely takes work on our part and integration on our part
Mhm.
in order to help other people, find that similar healing.
Yeah. So let's talk about OCD. Like what's your take on OCD that I think, any audience who's kind of contemplating, oh, I think this is OCD. I think, I need to get treatment or I'm confused, right? What was your kind of take? What was your most common kind of myths that you debunk, when a OCD client kind of first walk into your door?
Yeah, very good question. I think for me, it started with myself.
Mm.
So OCD is a part of my lived experience as a clinician. For me, it was more of like the scrupulosity subtype or relationship OCD. And so I can get more into that in a minute. But um, I think, I already had an understanding of what it looks like just based on my own personal experiences with it growing up, and even when I was in seminary and when I had left seminary and I met my wife, So whenever I meet a new OCD client, I'm like, um, it's so great to see you. I totally get it. There's nothing to be afraid of here, right? And so, but I think for a clinician who hasn't experienced it personally or who isn't really trained with OCD, I think that there can be a lot of confusion sometimes, particularly with like different subtypes of OCD, like self harm OCD or different sexual themes of OCD. I think it could maybe scare a clinician to hear some of the things that OCD people talk about that they struggle with, like fear wise. So, yeah, I don't know if that answered your question.
Can you explain to us what scrupulosity subtype is and relationship OCD is?
Yeah, so the funny thing about OCD is that we need to remember that it attacks what we value most in our life.
Mm.
So for me, it attacked my faith. my relationship with God. And so that's the scrupulosity. And scrupulosity is just a fancy word for a fear of blaspheming God, a fear of offending God, a fear of sinning, doing something wrong that'll send you to hell, stuff like that. And then also like morality, whether you did something right or wrong. So that's scrupulosity. And then relationship OCD is a fear of not being in the right relationship, a fear of maybe offending your partner, which then will ruin the relationship. Yeah, so basically, it's a fear, a doubt that targets different values in your life, right? For harm OCD, it's a fear that you're going to hurt yourself even though you don't want to. And when I say hurt yourself, I mean like physically, like in a possibly fatal way, right? So yeah, it's pretty debilitating. The people that have come to me and they're saying, I've got all of these fears, these doubts, these worries. They're just spiraling in my head. They're ruminating over it, is what we call that. And, my job is to remind them that you're not crazy. This is OCD. This is what OCD looks like. This is what it tells us and what it does to us.
Yeah. And this is maybe like a colleague to colleague. Like, how do you differentiate OCD versus like generalized anxiety disorder or other anxiety types? Like, how do you see it in the therapy understanding?
Yeah, yeah. So a lot of times they are intertwined, right? So whenever I'm working with someone with OCD, what really distinguishes OCD versus anxiety is doubt, right? So they call OCD the doubting disorder. And by they, I mean like the professional community. So yeah, if there's doubt, if there's excessive worry, fear, even, I would say that's OCD. And what that looks like is the obsession and the compulsion, right? So an obsession is in your head, right? It's the initial doubt. And then the compulsion is either outwardly behavioral, like checking, cleaning, avoiding, asking for reassurance, counting, stuff like that. Or even those mental ruminations, that's also considered a compulsion. So if we're seeing those things in the client, then it's safe to say that that could be OCD. But with generalized anxiety, it's definitely more of a persistent worry, maybe some fear, but I would say just like worry, tension in your body, maybe racing thoughts, but those thoughts aren't necessarily obsessional. And so they look very similar. They sometimes coexist together, but there is a difference, right? And the difference is that one of them has a cycle involved, which is the OCD cycle: obsessions, compulsions, temporary relief, and then you go back into that cycle. And then the other one is more of like a steady, consistent worry that has an impact on what we're feeling physiologically, like tension, pressure, increased heart rate, sweating, all those like physiological symptoms. So I would say those are the major differences between the two.
Thanks for tuning in. If you're feeling burnt out but are still pushing forward and don't know how long you can do it, join the Driven but Drained Intimate Workshop where I share my real lows and now my real wins. Real talk, real story. Sign up now at eugenekim.com/be still together. I'll see you there. Yeah. And what I've seen too is that I usually say that anxiety is kind of like a water balloon and you drop it and it kind of spills over everything. That little anxiety and little worries can evolve into different sectors. And that's why at certain point, OCD and anxiety is like a different animal, but it does kind of spill over and mimic each other, and those rituals that kind of gave you relief in generalized anxiety disorders can kind of turn into that perpetuating, behaviors just for constant relief as well, right? So this is just to say that if anyone found this very interesting, it's that there's a lot of perplexities and complexities that comes into mental health disorders. And, unfortunately, while some might claim it, there's no imaging done or blood work done that, pinpoints like diagnosis. And it's very confusing, and I would definitely recommend talking to a professional than, spending hours researching to figure out what your diagnosis is. Talk to me about men's health, because especially with somebody who is trying to go to be a priest, right? In the family culture, and you're a man. And was there any looking back, right, as a therapist, like, oh, these were some of the obstacles that I had to kind of overcome, to take care of my mental health. And I want the, men who are listening to this to know this, right?
Yeah, I think for me, growing up, mental health wasn't talked about a lot, but it wasn't brushed under the rug either.
Mm,
My Now that I look back and I kind of look at how my parents operated, they didn't deny mental health, but it was just never talked about. It was kind of in my family, it was like, okay, let's give it all to God, right?
mm,
Let's surrender our worries to God and let's, pray about it. And on the one hand, that's a very beautiful thing. But on the other hand, for me,
mm-hmm,
I wish that I would have known more about anxiety, or
mm,
I would have known more about like OCD tendencies, right? So that was kind of my experience growing up. It wasn't the worst experience. I just wish that it was a bit more, right?
mm,
And I think for every man and in different cultures, that looks different, right? So I've worked with a lot of clients where they really struggle to open up emotionally. And so there's a struggle with that emotional vulnerability. And so for them, when we've talked about their past, we've talked about their childhood together, we've come to the realization that parents would never encourage them to express their emotions, right? Where
mm-hmm,
parents would say, "Oh, don't cry. You need to
mm,
be like a rock, be like a stone,
mm-hmm,
be solid,
mm-hmm,
don't cry." And I think that that can be seen across cultures, right? Like,
mm-hmm,
I'm speaking as a white man,
mm-hmm,
and the clients that I'm thinking of are white, Hispanic, stuff like that. So I think that this, I'll call it a masculinity crisis, right?
mm,
It can be seen across cultures.
yeah.
And I say crisis, what I mean is like just this struggle with being vulnerable with ourselves, with our emotions, and then with our partners or with our family members, right?
Mm-hmm,
So I definitely do see that. I think that it's more permissible for women to cry in the household growing up as young girls and even as adults. I think things have gotten much better in our culture. Like mental health is definitely more talked about, there's less stigma. But I think that men have sort of internalized, just like as a culture, like men have internalized this idea that we need to be the strong ones,
mm,
emotionally, physically, all of that.
mm-hmm. I think few things is like I agree is in the beginning, like I was like, oh, this is like a Asian American, Asian parent, crisis, or the tiger mom, or whatever. But the longer that I do psychiatry, there's really culture is important, and I think culture makes it very unique individual process, but problems are universal,
Hmm.
and pain is universal, and our childhood needs and wants are universal. And, that's something that I'm starting to appreciate more. And I think there is this unfair expectations from boys to be rough, outgoing, and no feelings, just act, 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 and run, run, run kind of thing. And there was a pressure for girls to not speak their minds and just serve, just be submissive and just make everyone kind of happy. But at the end of the day, though, I just kind of think both boys and girls were expected to just make parents' life easier, and more convenient, whatever they believed, so that produces lack of awareness, like emotional awareness, lack of emotional expression, and vulnerability and resilience.
Yeah, I totally agree. I think we're seeing a shift. I'm excited. I don't know about
Mhm.
you, but sometimes I'm on Facebook too much.
Me too.
And I'm in different like parenting groups and stuff like that. Some of them are faith based. Some of them are just like I'm in a dad group, and there's like
Uh-huh.
thousands of dads in this group throughout the U.S.
Yeah.
And so it's really interesting to see like the vulnerability in the group, because lots of times I see posts about my spouse and I are getting a divorce. How do we help the kids through this? Or
Mm.
I see posts about, gosh, we're entering the terrible twos. How do I navigate this? That's actually where I'm at right now. So I'm like, I'm reading that one really closely. I'm like, okay, I need some, I need some help right now.
Yeah, yeah, yeah.
And it's really interesting because on the one hand, social media has made things so accessible, and people behind a screen, I think, find it easier to type something up and share
Mm.
it than in
Mhm.
person. That's a different subject, but
Yeah.
when I'm reading the comments, I'm seeing some men sort of talk about gentle parenting, or
Mm.
some men are bringing up therapy, some men are bringing up attachment. And I'm like, yes,
Yeah.
I love this.
Yes.
And then other men are still struggling with this sort of, I guess, not ideology, but this belief that no, just rub some dirt on it, tell them to get over it, suck it up, move forward. That's what I had to do.
Yeah.
And look at me
Yeah.
now.
Yeah,
And
yeah, 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 yeah.
I'm like, yes, look at you now. But so yeah, I say that just to say that like I'm seeing changes in the culture, right? And that brings me a lot of hope. It
Mm.
makes me excited to know that men are more involved and more curious and interested in how to raise stable, securely attached children.
Mhm.
So that's a good thing. But, on the other hand, there still are men out there who have been raised under the belief that it's okay for me to be hard as rock, and this is how I'm going to make it through life, and it's okay for me to raise my children that way.
Yeah. Yeah, definitely. It's always like in anything, pendulum swings the other way every generation. And I think there's a reason why our generation is talking about attachment theory and unmet childhood wounds because of our previous generation, right? And for me, I guess I'm moderate in a sense that I believe in emotional expression and awareness, but I also believe in emotional resilience. For the trick is that for you to be resilient, you have to learn to express it.
Yes,
That practical resiliency and, well, I have to provide for my family, so I can't let my, sadness get in the way, which is so valuable, right? And is very responsible for the dad figures to think that, and I want to honor that. But at the same time, we can get there. It's a little bit circle around, but we can get there by expressing your emotions, and it gets easier and easier. So you're not like, you know, punching a wall, or, sobbing only at funerals, right? Like you can say, today I'm a little bit sad, and let everybody know and connect with you day to day, right?
exactly. Yeah. Yeah, it helps. You mentioned like we have to identify and accept the emotion to grow in resilience, but not just grow in resilience, but to help us actually feel the emotion, right?
Mhm.
I think what I'm seeing, especially like in the context of OCD and anxiety, which is really debilitating and difficult, is that the reason why people want to, find a relief is because the emotion is too difficult to
Mm.
feel, right?
Yeah.
And
Yeah.
so when I'm working with my clients, I'm like, let's just sit here and feel this. Like, we
Mhm.
don't need to do anything about it.
Yeah.
We literally just need to learn how to feel.
Yeah. I always say that emotion's like a wave, and once you learn to ride that wave, it's not that scary anymore. That's a really good point because it's that uncomfortable feeling that we want to make it go away, so we compulse. Some people just like overschedule themselves, keep themselves busy, like just that awkward silence with yourself is so uncomfortable. So then you're like texting somebody, you know, you're doing scrolling on the Facebook reels or something like that, just to distract themselves. But it's that skill to ride the wave that is so powerful. And I'm so glad that you're bringing that in real life, in vivo, in your space with your clients. That's very important.
Yeah, thank you. Yeah, it's exciting work. It's challenging, but it's really exciting. And I think it's foundational if we want to see a culture shift.
Hmm. Yeah. So, Luke, as we wrap up, is there anything that you wanted our listeners to know? If they're struggling with OCD or if they're a man of the house and they're like, you know what, this is very interesting because it's making me believe that it doesn't mean that I'm soft or weak, when I'm vulnerable with emotions. What do you want to say to our listeners if they have that curiosity in their heart?
I think it's important to know that we need to be careful about placing these limitations on ourselves as men, these emotional limitations, saying that things emotionally are good or bad. I really don't think there's even a need to label things at times. I think there's a need to just accept what is in the present moment as it is, right? And so I think that's where parts work can be really helpful, identifying the angry, the anxious, the uncomfortable, the overwhelmed parts of us, right? Identifying them, accepting them for what they are, and letting them coexist with us without behaving in ways that we don't value or agree with. So that would be my advice to everyone, but men in general, is just to approach your emotions with curiosity, but no judgment, right? Because emotions aren't good or bad, they just are. They exist, and we have to learn how to, as you said, ride that wave
Mm-hmm.
and cope with them in healthy ways.
Mm-hmm. Yeah. Well, thank you, Luke, so much for your time and this very insightful conversation. I'm gonna put his link in Integratus Counseling PLLC so that you can find more of his work. But everybody, take care of yourselves, and your feelings and your thoughts are valid, and we'll ride this wave together. Thank you so much.